Hi, I'm Chris Eldridge from Maiden, Director of Operations.
Thank you.
A lot of services are really challenged at the moment by getting patients off waiting lists into care. There is a lot of need and staff shortages, really providing capacity in services to be able to treat all of those that really would benefit from some kind of support in one form or another. So there are some really key advantages to using digital tools within a care pathway. Um, it's really about adding to a toolbox of care that can be offered. One of it is replacing any traditional face-to-face or telephone offerings. It's about providing more opportunities and more options to patients. Sometimes that's to allow them to fit care around lifestyles, particularly busy parents. Making time to be able to come to appointments in person can be really quite challenging if they need to take public transport, for example. So being able to fit 20-minute chunks of guided self-care into a busy lifestyle can really mean the difference between engaging with a form of treatment and not. The other reason for digital tools supporting services is really just being able to provide care whilst they're waiting for maybe a more traditional phone call or a face-to-face. So it allows you to provide wellness whilst on waiting.